Approved. We'll go to item 7A is consideration and possible action concerning approval of the contract for Eureka County to become a member of the Central Nevada Health District. Mr. Weed.
Thank you, Mr. Chair, members of the board. As this board is aware, there's been a long haul here to get SB 118 passed and to allow for Eureka County to become a member of the health district. SB 118 did pass. It was effective immediately upon signature of the governor, and so we're here today based on Eureka County's passing of a resolution requesting to join the health district. That's the avenue that's been set out in the ordinances passed within the individual counties and cities, that the new member would request by resolution to become a member, and then upon majority vote of this board, they would become a member. Following what is likely to be approval by this board, Eureka County will have to pass an ordinance substantially similar to those that have been passed in the other members of the district. They have 60 days to do that. Those things are underway, and so at this time for this board is the request for a motion to approve Eureka County to become a member of the Central Nevada Health District.
Okay, thank you. Any questions of Jeff on item A? Any public questions? Being none, back to the board for a motion.
Cassie Hall, for the record, I so move.
We have a motion. Do we have a second?
Bob Erickson, all second.
We have a motion, a second. All in favor?
Aye.
Aye.
None opposed? The motion carries, and the contract for Eureka County has been approved. We'll go to item B, consideration and possible action concerning approval of an interlocal agreement between Central Nevada Health District and Eureka County, setting forth the scope of work for each entity from July 1st, 2023 to June 30th, 2024, including the payment by Eureka County for services provided by the Central Nevada Health District. Jeff.
Jeff Weed from the Churchill County District Attorney's Office. Thank you, Mr. Chair. Before the board at this time is the same interlocal agreement that's been entered into with each member of the district previously. These are for a year period of time from July 1st of this year through June 30th of next year. It's anticipated that the scope of work, as we I guess have a little better idea of the intricacies of it, will expand, and we can do those kind of things. And so these are kind of some general, I guess a general scope of work that each member is going to be receiving from the health district. But also included in this are the fees that will be paid by Eureka County. And again, this is the same interlocal agreement that's been signed by all other members of the district. It's been approved and signed by Eureka, and it's before this board for a motion to approve it at this time.
Okay, any questions of Jeff from the board or the public? If not, I entertain a motion.
Mr. Chairman, I would move that we approve the interlocal agreement between the Central Nevada Health District and Eureka County.
We have a motion. Do we have a second?
This is Tyson McBride. I so move.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and the interlocal agreement between Central Nevada Health District and Eureka County has been approved. We'll go to item C, consideration and possible action concerning the appointment of Dr. Ted McDonald, MD, OD, MHA, as the District Health Officer for the Central Nevada Health District, and approval of the agreement for professional services between the Central Nevada Health District and Dr. Ted McDonald, MD, OD, MHA, for professional services as the District Health Officer from July 1st, 2023 to June 30th, 2025, with payment of $30,000 per year. Mr. Weed.
Thank you, Mr. Chair and members of the board. The name of the agenda item kind of covered most everything. But as this board knows, Dr. McDonald has been serving as the current health officer, and we approved I believe at the last meeting, or you approved at the last meeting, to be able to enter into negotiations with him, having received his CV and application for that position. That has been done, and there's a contract before the board that details the scope of work for him, including the payment of $2,500 per month for a total of $30,000 per year. As this board's aware, per statute, the District Health Board appoints the District Health Officer, and he serves at the pleasure of the board. The board fixes the salary for the District Health Officer, and so all those things were negotiated. They've been included within the contract or the agreement before the board. And so there is a request for a motion to appoint Dr. McDonald as the District Health Officer and then to approve the agreement for professional services that's before the board.
Okay, thank you. Are there any questions for Mr. Weed from the board or the public?
And I will add that, it is from July 1st, 2023 to June 30th, 2025. There is a provision in there that it will automatically renew unless there's notice given, those kind of things. And so that's how the contract is written.
Okay, thank you. Being no questions, I'll entertain a motion from the board.
Mr. Chairman, I move that we, appoint Dr. Ted McDonald, MD, OD, MHA, as the District Health Officer of Central Nevada Health District, and approval of the agreement for professional services between Central Nevada Health District and Dr. Ted McDonald for professional services as the District Health Officer from July 1st, 2023 to June 30th, 2025, at a rate of $30,000 per year.
Do we have a second?
For the record, Larry Rackley, I'll second that motion.
We have a motion, a second, all in favor?
Aye.
Aye.
None opposed? Motion carries. And Dr. McDonald has been appointed as the District Health Officer for Central Nevada.
Welcome.
Thank you.
Yes.
Appreciate it, Ted. Good luck there. Item D, consideration and possible action concerning adoption of Resolution 21-2023, a resolution authorizing the Central Nevada Health District Administrator to apply for grants and to require that any acceptance of grants be approved or ratified by the Central Nevada Health District Board of Health. Mr. Weed.
Thank you, Mr. Chair and members of the board. This resolution was discussed and is brought before you for consideration today to essentially clarify direction for the administrator on how this board wants the administrator to proceed. This specific resolution covers grants that authorize the administrator to apply for any grants without coming for authorization for those. But upon acceptance, they need to bring it back before the board, before they accept, or they need to come back for ratification of the board. So you're informed, you're up to date, and you can make decisions and weigh in on that. So that's what this resolution does. If this board so wishes to adopt it, there'd be a motion to adopt Resolution 21-2023.
Okay, any questions of Jeff from the board or the public? Being none, I'd entertain a motion.
For the record, Larry Rackley, I make a motion to adopt the resolution 21-2023.
I'll second.
We
Bob
have-
Erickson for the record.
We have a motion and a second. All in favor?
Aye.
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 None opposed? The motion carries, and Resolution 21-2023 has been adopted. We'll go to item E, consideration and possible action concerning adoption of Resolution 22-2023, a resolution authorizing the Central Nevada Health District Administrator to authorize, approve, and implement internal policies for the Central Nevada Health District and to provide the Central Nevada.
Proceed with policies. July 1st is coming up very quick, and there are a number of policies being worked on, and to bring them before the board, before each policy is implemented or adopted would be difficult. And so what this would do would authorize from the board for the administrator to authorize those, to implement them, but that at the next regular board meeting, the administrator would be required to provide notification to the board, not for ratification or anything like that, but if the board has an issue with something, they're aware of it, they can see the policies, that you can read them, and you can weigh on them if necessary and provide further direction. And so that's what this resolution does, and it would streamline that process. And so were this board to adopt this resolution, we'd ask for a motion to adopt Resolution 22-2023.
Any questions of the board for Jeff? Any from the public? Being none, back to the board for discussion or a motion.
Mr. Chairman, I would move the adoption of Resolution 22-2023.
We have a motion, do we have a second?
Second.
We have a second. All in favor?
Aye.
Aye.
None opposed? Motion carries. Thank you, Jeff, appreciate it. We'll go to item 8A, consideration and possible action concerning E.H. Hirsch Pool Insurance Policy FY '24. Ms. Ernst.
Good afternoon, Mr. Chair. For the record, Shannon Ernst. I came down here, I was hoping the echo was a little bit less. But today I have before you the renewal for the policy for the pool insurance with A.H. Hirsch. This policy would take effect on July 1st and take us through the next year. I do want everyone to be aware, as we are adding equipment, we're adding medical staff, those things, we will come back for a change in the policy, but this will be effective Saturday. And as those things add on, we'll be coming back. Because currently this covers everything we have on staff until those transfers are completed. The total renewal is $5,101.18. If there's any questions.
Are there any questions from the board or from the public? If none, I'd entertain a motion.
Mr. Chairman, I would move that we approve the insurance policy as presented at a premium of $5,105.18 for fiscal year '24.
Do we have a second?
I'll second.
We have a motion and a second. All in favor?
Aye.
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 None opposed? Motion carries, and the insurance policy with E.H. Hirsch and pool insurance policy have been approved. We'll go to item 9A. Under new business, consideration and possible action concerning approval of a contract with David Evans, RN, MSN, to provide health services in the district for the amount of $200 per day as scheduled July 1st, 2023 to June 30th, 2024. Ms. Ernst.
Again, for the record, Shannon Ernst. Today I have a contract before you to provide a contracted service for nursing. During COVID, we found it very useful and helpful to contract some nursing staff to meet the needs across the region as we responded to the pandemic. Mr. Evans has been with us through that time. He has offered to stay on as we move forward and serve those communities until we are fully staffed. So today I'm asking that we maintain that contract. It is paid at $200 per day worked, and if he travels outside of the area, we pay his travel expenses, per diem, etc. This is all covered under a CDC grant we have that will be maintained by the Central Nevada Health District. We're waiting for those renewals and transfers. So we'd just like approval today to maintain him. Any
Okay,
questions?
thank you. Any questions from the board or from the public? Being none, I'd entertain a motion.
For the record, Larry Rackler, I make a motion to approve a contract with David Evans, RN, MSN, to provide health services to the district for the amount of $200 per day, as scheduled July 1st of '23 to June 30th of '24.
We have a motion, do we have a second?
Bob Erickson for the record, I'll second.
We have a motion and a second, all in favor?
Aye.
None opposed? Motion carries, and the contract with David Evans has been approved. We'll go to item 9B, consideration and possible action concerning approval to request a transfer of a Toyota Prius from Mineral County to support service delivery in the district. Ms. Ernst.
For the record, Shannon Ernst. Today, we're asking for authorization to request a transfer of vehicle from Mineral County. They do have a Toyota Prius that was purchased during the pandemic with COVID funds. And with your authorization, we would put in a request to the Board of County Commissioners, and we're asking if that is approved by them, that we accept that vehicle. This is something that we will be reaching out to all of our partnering communities for resources they can provide, so there's less expenses to the health district as we launch out. In Eureka, they transferred us a vehicle prior to it going to the Central Nevada Health District, so it's on the county's rolls and will be transferring to Central Nevada Health District. So this would be the same thing. This would go onto our insurance, onto our policies, and be utilized by the staff to respond.
Okay.
Any questions?
Any questions? Being none, I'd entertain a motion.
Mr. Chairman, Bob Erickson for the record. I move that we approve the transfer of a Toyota Prius from Mineral County to support service delivery within the district.
We have a second.
Tyson McBride for the record, I second.
We have a motion, a second. All in favor?
Aye.
Aye.
Any opposed? Motion carries, and the vehicle will be transferred, will be requested to be transferred from Mineral County, and then you'll add it to this insurance policy with Hirsch. Okay, thank you. We'll go to item C, consideration and possible action concerning agreement with Unite US in the amount of $10,000 to provide resource linkage for the district from July 1st, 2023 through June 30th, 2024. Ms. Ernst.
For the record, Shannon Ernst. As we were looking at the launch of Central Nevada Health District, one of the biggest concerns was understanding all the resources across the area. It's 650 miles. You have some areas such as in Eureka that are using a lot of resources out of Utah. And through our research, we came across a company called Unite Us. They're very new to Nevada. They're starting to have heavy influence within Reno and Clark, and they're starting to develop across the rurals. As they actually approached us for Churchill County Social Services, because one of the things is they do provide an overall referral service, linkage, and then it allows for your community health workers to do a follow-up and track that. This wasn't really something that we needed within Churchill County, but I identified that this could be a great resource for Central Nevada Health District. So through this process is what would happen is if we sign this agreement, we're receiving a $10,000 membership with them. They actually conduct the mapping of resources. So through our works, we've been mapping locally, but they look at anything that can help these communities link community members to fill those gaps, to keep them living independently and safely. So today, if this was approved, we would be able to obtain the software. We would be able to get training for our community health workers and other staff, and they would begin to develop that system for all 4 counties. This is an online system, so if our community health workers are out working in the field and they identify they really need to find a resource, say for housing in Pershing, this would be able to look at what are those available, how do we link them, and then if an application's put in, how do we follow up, and it keeps those case notes, which is a huge part in any kind of human services activity. It's not just doing the linkage, it's making sure you have the follow-up and making sure that happens. So today I'm asking that we do enter into this agreement with Unite Us for the $10,000 for July 1 through June 30th of 2024, so we can begin the process.
Okay, thank you. Any questions from the board or the public? Being none, I'd entertain a motion.
Mr. Chairman, Bob Erickson for the record. I move that we enter into an agreement with United US in the amount of $10,000 and authorize the interim administrator to execute said agreement.
We have a motion, do we have a second?
Larry Rackley, I'll second that motion.
We have a motion and a second. All in favor?
Aye.
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 Opposed? None opposed, the motion carries, and we've authorized entering into an agreement with United US in the amount of $10,000. We'll go to item 10. Are there any consent items? Now, being none, we'll go to item 11. Are there any items to be considered to be put on a future agenda? We'll go to item 12, consider and select or schedule future meeting date and locations.
Our next regular scheduled meeting would be on July 13th, if you wanted to stay on schedule, for the second Thursday of the month at 1:30 in the afternoon. Currently, we are scheduled to be placed here, and with a Zoom access, which is always up to the board. And I don't think we have any reason to schedule a special meeting for July at this time.
Okay, July 13th at 1:30 unless enough have a problem with that date, and if so, you can get back to Shannon with that. Okay, we'll go to item 13, public comment, general in nature, not relative to anything on the agenda today. Discussion can be held, but no decision can be made. Being no public comment, we'll go to item 14, and nothing else, we stand adjourned. Thank you all for being here, and thank you for those who joined us online.